Millions of Americans face skyrocketing health insurance costs as political gridlock threatens coverage. The clock is ticking for millions of middle-class Americans who could soon face a devastating financial blow. As health insurance subsidies teeter on the brink of expiration, a fierce battle between Democrats and Republicans has brought Washington to a standstill, leaving families across the nation in limbo. But here's where it gets controversial. While Democrats urge immediate action to extend these vital tax credits, Republicans argue there's no rush, despite warnings from experts that delaying could lead to chaos in the healthcare system. For months, state health insurance commissioners have been sounding the alarm, cautioning Congress that without intervention, premiums for millions could double or even triple.
Yet as the government shutdown persists, the situation grows more dire by the day. Democrats insist that Congress must act now, before open enrollment begins on November 1st, to prevent widespread disruption. Republicans, however, remain steadfast in their refusal to tie healthcare policy to the government reopening bill, claiming there's ample time to address the issue before the subsidies expire on December 31st. And this is the part most people miss. The reality on the ground is far more urgent than political posturing suggests. Insurance companies have already submitted their rates, and consumers are receiving notifications of impending cost increases. Devin Trolley, executive director of Pennsylvania's insurance marketplace, warns that waiting until the last minute will create a chaotic and messy situation, leaving families scrambling to afford coverage.
The consequences of inaction are stark. Even if Congress eventually extends the tax subsidies, insurance commissioners fear the damage will already be done, with hundreds of thousands of Americans losing coverage. The National Association of Insurance Commissioners has been pleading with lawmakers for months, emphasizing the need for a gradual phase-out of subsidies to minimize the impact on families. Yet, their warnings have largely fallen on deaf ears, as Congress seems content to wait until the 11th hour to address the crisis. Here's the kicker. This isn't just a partisan issue. Insurance commissioners from both red and blue states overwhelmingly support extending these tax credits, recognizing their critical role in keeping healthcare affordable for millions. Yet, political gridlock threatens to undermine their efforts, leaving families across the country vulnerable to financial ruin. As the debate rages on, one thing is clear: the stakes couldn't be higher. With 24 million Americans relying on subsidized health coverage, the consequences of failure are too devastating to ignore. So, we have to ask, is it fair to hold healthcare hostage to political brinkmanship, or should Congress prioritize the well-being of millions of families? The answer may determine the future of healthcare in America, and it's a question that demands urgent attention from lawmakers on both sides of the aisle.